Okay, it got cut off. I'm sorry. If you're not familiar with that drug, it's a very, very powerful narcotic, and it knocks out the pain. So what I was explaining to him, which I would have thought that he would have already knew this, in hindsight, I do think that he already knows this. But so he's asking me about my condition. Okay. Now, keep in mind, they're writing all this stuff down as we're talking. And so I said, well, my pain level fluctuates. And so for me to explain to you how I'm actually feeling, that's kind of a subjective question based on where I'm at with the medication. Meaning if I popped it 15, 20 minutes ago, 30 minutes ago, I'm probably feeling pretty dang pain-free, almost no pain at all, or very little. If it's been all night and I first get up in the morning, well, I'm going to be in extreme pain. Okay. So he said, no, I'm talking about without any of the medication at all. What is your pain level, assuming you weren't on any medication? Okay, keep that in mind. That's going to be important later on in this story. And so I said, well, it's almost unbearable. I mean, it's like maybe a 9 out of 10. Okay. And I'm a fairly tough guy. I mean, it's extremely painful. I live and function totally dependent almost on pain medication. Okay. That's how bad my back problem is. Okay. So, and I wanted to give him as much information as I could, so that they could properly diagnose me and come up with an accurate care plan. Okay, so here's what happened. So then they decided I needed these trigger point injections, this natural supplement or whatever that they inject into the muscles. They do this thing called decompression, where they put me on kind of like an inversion table, or where they strap they put like a harness around my head, elevate the table so that I'm about maybe at a 45-degree angle. My head is up and my body is elevated down, and then the table vibrates. And it's similar to traction. It's not a traction table, but it's definitely related to that. Basically, the object of it is to vibrate and basically to stretch my spine out in hopes that the disc will go back into place. Okay. That's one of the things that so the injections, the decompression table, then they done this thing with physical therapy, they called it. It was sort of like it was a device that basically had like a rubber ball on the end of it, and it kind of hammers all over up and down my spine. And I'm not really sure what the object of that is, but it all had to do with this care plan. Then every time I went, the chiropractor would do an adjustment. In other words, he would like put his knee or whatever, like twist and try to pop my back and so forth. And then also they would do a series of stretches, exercises, and so forth. Kind of therapy, kind of on the same line as physical rehabilitation therapy, which I'm also going through now. That's another video. Now I'm going through a doctor now to try something else. But and then they gave me these styrofoam blocks that are shaped different ways. They sold, it was part of this package that I was to do at home, which I'd done some, probably not 100% of what I should have, but anyway, that I've done that 24 visits. The cost of it was $3,000. Okay, and like I said, I'm not throwing off on this organization at all. I feel like this organization was extremely professional. I think that they done everything they could possibly do to try to help me. And I have no criticism. I mean, I'm not blaming them because I didn't get better. I'm not blaming them because they didn't know what they were doing or because they're a bunch of jacklegs. That's not what I'm saying. Here's my criticism of that organization and what just ticked me off about the way they done things. The owner of the place, in particular, the main doctor. Every day when you go in there, they give you a piece of paper. It says, it asks you, is your condition any better? Is your condition any worse? It's basically just a little piece of, paper with a few questions on it. Is your condition any better? Is your condition any worse? What is your pain level at right now? Now, remember at the beginning when I said, when I first went in there and he said, what is your pain level at? And I told him it was pretty much unbearable without the medication. Okay, so now he's asking the same question, but a little bit different. And he's saying, so I asked him about that. And I said, what does this mean? And he said, it means just what it says. What is your pain level at right now? I said, well, I just now I got out of bed and took some medication, so it's not really hurting all that much now. And he said, just answer the question. So I did. I put 5 on there, or 4, depending on where it was at. So did you see that? So then we get through like halfway through these 24 visits and we have this meeting and they look at these pieces of paper from when I first came in there and I said that my pain level was at a 9 or an 8 or a 9 or a 10 or something like that, almost unbearable. And then they're saying, well, look at here, you've been coming here for a couple of weeks and your pain level is at a 4 or a 5. You see what I'm saying? So here was their takeaway from all that. Clearly what we are doing is helping you. Okay, now I'm just going to let you think about that for a minute. Okay, so then I took responsibility for it. And I said, okay, wait a minute. I have been giving these guys false information. We're not on the same page because they're thinking that I'm getting better based on the fact that I'm not complaining enough, so to speak. Okay, so I went to the guy. I'm going to call him a doctor. I went to him and I said, dude, and I never blamed him for anything. This is what I said. I said, I think we have a misunderstanding. And I think that based on those little pieces of paper that I fill out every day when I come in there, you're thinking that I'm getting better when I'm not. This is when I said that, this is when everything changed with this dude. All of a sudden, we're not friends anymore. By his choice. It's like it pissed him off. Okay. So then he starts to tell. So then he does this evaluation thing. He takes this several things. He does reflexology on my knees. He's checking for nerve damage. He takes this red and white striped banner thing and runs it back in front of my eyes, and I'm supposed to follow it with my eyes. And in his opinion, it had something to do with how well my nerves were working. Okay, so he done all this stuff, and he said, well, clearly, based on my observation, you're much better than what you were when you came in here. Okay, now I'm getting irritated. Now I'm getting pissed off because I have this dude. I mean, I know I paid this guy his money before we ever started. Okay. They claim that the first visit's free. That's not true. That is false. Yeah, the first visit's free if you don't go to the other 23. Yeah, that's true. But if you buy into this little program, and he said after that first visit, remember that it was supposed to be free? Okay, there is nothing free in this world. Most of you people realize that. Anyways, when he billed me for these 24 visits, guess what? That first visit that was free, it was on there. And it was one of the 24 that I was being billed for, which is $3,000 away from not being free. Okay, so that wasn't entirely true. But anyway, so basically what he's saying was, well, your nerves, your eyes can follow this red and white striped banner thing better than what they could 2 weeks ago or 3 weeks ago, whatever it was. Maybe it was a month ago. And your reflexes, when I hammer on your knee with this here reflex thing, your reflexes are better than they were a month ago. And I said, well, that is a great observation on your part, sir. And I won't argue with you one bit. But here's the only problem. I didn't come here complaining about how well my eyes moved or how well my reflexes worked. I came in here with back pain, and my back pain is just as painful today as it was a month ago when I came in here. Okay, so we sort of had this going back and forth thing going on. Okay, and we didn't really, and then he started talking to me about the pain medication. He told me I need to stop taking the pain medication because it's actually causing me more problems than it's helping. That kind of ticked me off at the time. I'm going to come back to that later because there is a certain amount of truth to what he was saying about that I found out later on after talking to some professionals, studying up. But I'm going to do a video on pain meds. It's not entirely true what the guy said, but there is an element of truth to that. And I am, in hindsight, I'm glad that he said it because it caused me to study. And I did get some information. There is a certain amount of truth to that. But anyway, he came out at one point and said, your pain is all in your head. That I was ready to punch him at that point. I'll be honest with you. I mean, basically, I felt like he was trying to psychologically convince me that I was better. And it was highly offensive to me. But I had already paid for all these visits, okay? And so I continued to go to every one of them. The attitude was a little bit different. He treated me a little bit, you could tell he was kind of upset with me and didn't really like me after that. But he done his job. I mean, I'm not saying that he didn't. He wasn't rude to me. He wasn't mean to me, but it wasn't the same happy good morning type of a thing after we had that discussion. Now that being said, I went to every visit just as, and he did finish on my last day there. He asked me again, so how are you? Are you better? And he basically asked me the question. He asked me some questions. I felt like he was trying to trick me into saying I was better. Okay. And that's the part that offended me. Not that I paid him $3,000 and gained absolutely nothing for it. That part didn't offend me because I've been in this game long enough to kind of be used to that. But what offended me was when I sat there, told him my condition is not improved. And he basically said, you're wrong. He literally said this. And I kind of caught the guy in a few dishonest things. And I'm sure that if he would deny this in front of people, he literally said this to me. He said, when you came in here, you were a surgical candidate. You are no longer a surgical candidate. He said those were word for word. 3 months later, I was in Tampa getting 2 surgeries. So, and how he would even, he's kind of arrogant to say that I don't need a surgery. I had another MRI. Matter of fact, I had 3 MRIs, all 3 along with a whole bunch of, and a whole other barrage of testing. From the first MRI, which was before he ever touched me, to the next MRI, which is after he quote unquote fixed me, and there was no difference. Matter of fact, my situation may have gotten worse. Not by any fault of his, but like I said in the beginning of this video, I'm not faulting him for not fixing me. What ticked me off about him was when he looked me in the face. A couple things that he said. One is, your pain is all in your head. That really offended me. And then when he told me that, I was a surgical candidate when I came in there, but after him doing his thing, I was no longer a surgical candidate. And then I went and actually had surgery. And I felt like the guy was really arrogant. I felt like it offended him that I said that his program didn't work. And I even reiterated to him, I said, look, dude, you have an excellent staff. I mean, these people work hard. You guys, they're doing as good as they can do. I told him that. I explained to him, I said, look, I'm not blaming you that I didn't get better, but I'm telling you that it is a fact. And it's like it totally irritated. It totally offended him that I said that. And then he was like out to prove to me that I actually was better. And then that's when he brought out all these little pieces of paper that he had that I filled out every day. And it's like I said, the relief that I was feeling from the medication that he says that he didn't want me on, he was taking credit and saying that his program was what was making me better when it wasn't. And so it's like I said, it's this chiropractic, neurological chiropractic type of situation. Again, just like I'm not telling you that it won't work. There are people that it has helped. There are people that go there like on a weekly basis and they're not fixed. Okay. He might say they're fixed, but that's not fixed in my opinion. If it's fixed, then that means you don't have to come back. You know, if you take your car to the mechanic to get it fixed, then you don't have to bring it back next week unless there's another problem. But that being said, that's fine. I mean, if I could go once a week, once every 2 weeks and maintain, I would do it. And I mean, I don't fault people at all for doing that. And I don't criticize him, but don't tell me that I'm better and you fixed me when you haven't. I mean, that's the part that don't be patting yourself on the back and giving kudos to yourself for doing something that you didn't do. And you've done that at my expense. I'm the one paying for this sucker. And I explained to him, I said, dude, and he told me about how many years he'd been doing this. He told me about all of his degrees on the wall. And I explained to him, I said, sir, I'm sure that you are a brilliant chiropractor. And I'm sure you are way more knowledgeable than I am about DDD, about back pain, about bulging discs. I'm sure that that's true. However, when it comes to how I feel, I think that I am more qualified to determine that than you are. And I didn't say it mean. I didn't say it rude. I said it just the way I just now said it on this video. And it totally pissed him off. I mean, it really upset him when I said that. He went and turned around and walked away. And then he said, have a great day, Rod. And I went and I left and I've never been back in there again. I went back in there later on, a few months later, to get my records from them so that I could take it to Laser Spine Institute, which they didn't care nothing about it, by the way. And they were very nice to me. They were very civil to me. I went in there and asked them for them, and they asked me to come back 2 or 3 days later and pick them up, and I did. And they weren't rude to me or anything like that. But so that's my experience with that. And I just wanted to explain that to you. Maybe that process will help somebody out. But, you know, again, it's just a lot of people want to, in this business, they want to give themselves more credit than what they deserve. You know, they claim that they're doing all this stuff, and maybe there are people that are getting help through it. You know, that's fine. And I'm great. I hope they are. But again, I'm not one of them. Okay, have a great day. Thanks for watching. I hope you get better soon.